Good morning. I'm happy to be here this morning to welcome Governor Pritzker to Headington Oaks in West Peoria. It seems like just yesterday you were here for our 4th of July parade. And I can't miss but ask you if you would like to come back in your schedule. This year will be our 50th. Because of the pandemic, we had to postpone last year. So you're more than welcome.
Well, then we have to have twice as much fun this year.
Yes, sir. So once again, thank you, Governor. It's always a pleasure to have you in our hometown of West Peoria.
Thank you very much. Appreciate you, Mr. Mayor. Well, thank you very much, Mayor Dillon, and always great to be back here in West Peoria. I want to thank, of course, leaders Jahan Gordon Booth and Dave Kaler, and Peoria County Board Member Jimmy Dillon. Our Peoria City County Health Department has set up this amazing vaccination operation here at Headington Oaks, and to the department's public health administrator, Monica Hendrickson, who has been fighting this battle with her team against COVID-19 since the very beginning. I just want to express my gratitude to you for your partnership in making sure that we're keeping people in West Peoria and throughout Peoria County healthy and safe. I'm very, very grateful to you, and I know that we're going to be relying upon each other as we move forward over the next several months as well. Peoria County is a leader in vaccinations across Illinois. If Peoria County were a state, it would be number 2 in the nation for total number of doses administered per 100,000 residents. That's very impressive. The team on the ground here is working at an incredible clip, with over 80% of the local population of those 65 and older and approximately 55% of the eligible under 65 population already receiving a first dose. Thanks to Peoria's great work and that of our 96 other local public health departments, Illinois has administered more than 2.25 million doses to our residents. So we now have given at least a first dose of the vaccine to 1 in 7 Illinoisans. And Illinois is first among the top 10 most populous states in the percentage of our population who've received first doses. That is great news. And even better news is this. Based on public commitments from the White House and from vaccine manufacturers as of today, Illinois expects to receive an average of at least 100,000 doses per day by mid-March, meaning that we're getting closer and closer to widespread availability that we all want. I'm very pleased also that this morning the J&J vaccine was moved forward in the process toward final EUA approval, perhaps later this week, and that will add more to our vaccine doses available. As Illinois expands our eligible population to the most medically vulnerable in accordance with the CDC guidelines, IDPH is working hand in hand with local health departments to expand local outreach through special opportunities like senior days, specific to those who are 65 and over, ensuring that our elderly residents continue to receive urgent access to this vaccine. I encourage all of our local public health departments, especially those not yet on pace for the expansion, to move as quickly as possible to broaden our reach in light of ever increasing federal supply. That means not only increasing the pace of vaccinations, but also doing the outreach and the education that's necessary to help those who might not have the technology or transportation, who may have been misinformed about vaccines, or who are otherwise distrusting of government or the healthcare system. IDPH stands ready to assist. So folks, I just want to be clear to everybody, things are getting better. This pandemic will end. But in the meantime, we have to mask up, we have to help each other out, and we'll get through this together. And now it's my great pleasure to introduce somebody that you all know as a state representative, but the rest of us in Springfield anyway know her as leader, because she truly is a leader, Jahan Gordon Booth.
Good morning, everyone. I could not be more excited to be here today because not too long ago, almost 1 year ago, we were having these kinds of press opportunities and unsure when we would ever get to a place like this. And so I want to first and foremost give my sincere and authentic thank you to Governor Pritzker. He has done a phenomenal job throughout this pandemic. I know that when he decided to run for office and run for governor, and he came to Peoria and he wanted to talk to those of us in leadership and those of us in the community in Peoria. There's no way that he thought that this is what it was going to be like, but you have done a phenomenal job in terms of protecting the public health of the citizens of this state. It has not been an easy job. We have watched you, and I applaud you for all that you have done on behalf of the citizens of this great state. I also want to give an extra special thank you to our very own epidemiologist, Monica Hendrickson. She is just an absolute star. She has been someone she's been our very own Dr. Fauci. She is someone who we have been able to rely on, someone whose honesty is one that we have come to trust and depend on. And I thank you because we are in such a critical time when our public health has never been more important in our adult lives. And your steadfast leadership has been incredibly important in this season, so thank you so much. I'm just here today in wanting to encourage others that when your opportunity comes before you and you have the opportunity to get the vaccine, please, please, please be willing to get the vaccine. We need to put this pandemic behind us. The leadership that has been shown by the state and our local county health department is nothing short of amazing. And I'd like to see us all be able to get back to the lives that we know and we enjoy. And the only way that we're going to be able to do that is we have to have folks that are willing to get the vaccine when their opportunity comes up. I certainly, trust me, when my opportunity comes up, I absolutely plan to get the vaccine. There's been a lot of conversation about how this pandemic has shown so many of the inequities that have always existed in our communities, particularly in many of the most marginalized communities and Black communities and brown communities. So as someone who wears that melanin in my skin, I want you to know that I absolutely plan to get that vaccine, as does my entire family, when our opportunity comes before us. So let's get our vaccine. Let's be sure to continue to wash our hands. Let's continue to mask up, and let's get this behind us. With no further ado, my good friend, leader, Senator David Kaitler.
Thank you, Leader Gordon Booth. It's a pleasure to work with you in representing Peoria area in the legislature. So you're my sister and my friend. Governor, thank you for coming. Peoria is a leader in getting the vaccines out. I'm trying to think of some of the benefits of being 72 years old, and it's that I've already had my first shot, so my second shot comes up next week. I was called by both health systems to make sure that I had my appointment. And I want to brag on Monica a little bit. I've had some calls from my colleagues in the Senate, and I'm not going to tell you who or where they're from, but they said, why is it that Peoria does such a good job? They really have their act together. And I said, it's because Monica Hendrickson knows what she's doing. And so I picked up the phone and I actually called Monica and I said, you know, I'm getting calls from my colleagues wanting to know what the secret is here. And she said, well, it's planning. It's making sure that you have a plan, you stick to it, and everything is on paper. You can understand it. And I won't try to explain it to her because she'll probably do that, but that's what it takes. And I think that as a community we've come together. I'm glad to hear that we were number 2 in the nation in this. That's astounding, but this is serious, and it's good news that we're seeing the light at the end of the tunnel. But we have to continue to mask up and to do all the protocols that we know we're supposed to do, because by golly, I want to be at the West Peoria Parade this summer, and I want to be able to have a good time. So without further ado, our superstar in Peoria, Monica Henriksen.
Thank you, Governor Pritzker, Mayor Dillon, and Representative Booth and Senator Kaler. This is, again, that data point is surprising because starting in March of last year, we started reporting cases, how many cases we had, then how many deaths we had, how many were covered at home, isolating, how many were still hospitalized, and we've watched it grow. In fact, in a call today with our team, we recognized that in mid-December, Peoria County was averaging over 1,000 new cases each week, and now we're just under 300. And so we've been reporting on those numbers, and to hear something as positive as the fact that our vaccination campaign is working, it's a good sign, and it's, I think, something that as a local health department here in Peoria, and I can speak in regards to our counterparts across the state, you know, we've been just boots on the ground working diligently since last March, really. And we continue to do the work that needs to be done. It's hard work and it is rewarding work, and we want to make sure we can bring our communities out of this pandemic in a healthy and safe way. So I'd be remiss to say that while we are doing well in Peoria, it is going to be an entire state and national campaign, and international campaign to get people vaccinated. So the news on Johnson & Johnson, the aspects of getting more vaccine in our community, this is just great information. We're working diligently with our healthcare systems to making sure that we do target our 65 and older, that we're working with those first responds and those other 1B groups, and then hopefully as this progresses, that we would be able to open it up further. We're not at that point yet. You know, we, along with other parts of our communities and country, just need more vaccines. So this is great news that we're hearing, and we really hope that we can respond effectively moving forward. And I would just, again, be remiss to say that, you know, in local health departments, we've heard all the voices, the concerns of our public. We live in those neighborhoods. You are our neighbors, and so we hope that we continue to do you guys proud by really working hard on this response. So with that, I will turn it back to Governor.
Thanks very much, Monica, and happy to take any questions from members of the media.
So, Governor, there's been mass vaccination sites open all across the state, you know, in Rockford, Carbondale, Springfield. Has there been any kind of opening one here in the Peoria area, or do you look at Peoria's overall vaccination statistics and say it's not needed here?
Oh, no, I would never say that. I mean, we need more and more. We're going to have more and more vaccine coming, and sometimes that means more sites. We want to make sure it's closer to communities of color, communities that are very vulnerable. Peoria has done a good job in that regard, but I would say we're going to take direction, though, from the local public health department, because nobody knows this community better than the local public health department does in terms of how to get those vaccines into people's arms best. So it's their advice that we'll take, and we'll work with them on those mass vac sites. But we do have teams available through our National Guard, and we're deploying them where the county public health departments have said, hey, can we get some help? We need a little more help. We aren't able to fully do what we need to do on the ground ourselves, and so we might need another maybe a team of National Guard to come help us open a new site.
Governor, you mentioned where the state leads when it comes to
Yes.
vaccinations. This NPR data now shows, though, that Illinois, when it comes to those who receive both doses,
Second
Illinois is
doses.
at the bottom of the country, near the bottom. Why is that?
So I don't know if you saw yesterday, I was talking about this as well. We did something that other states didn't do, and that was that we stayed in the 1A phase a week longer than other states. And it's because we wanted to get as many healthcare workers covered as we possibly could. And then on January 25th, we opened up into 1B. So when you count 3 and 4 weeks after January 25th and after that week, you're here, right, in this phase where now people who got their vaccines back then are getting their second doses now, as opposed to in other states, sometimes they got their second doses last week or the week before. But on first doses, and again, I compare us to the largest, most complex states, California, New York, Texas, Florida. These are big behemoth states that have complex populations, large territory to cover, just like Illinois does. And when you compare us to those states, in terms of getting a first vaccine into people's arms, we're the best. And you're going to see now, and you're hearing a few grumblings from public health departments around the state, hey, I'm getting more second dose vaccines to push into people's arms now than I am first. I'd like to have more first. Well, we're getting those second dose vaccines because now's the time that people are eligible to get that second dose. So you're going to see those numbers rise. And but I'm very proud of the work that we've done. I mean, we really, again, among those top states, we have a larger percentage of our population now with first doses in their arms than any of those top states.
And even with the, how well Peoria County's doing, we're not doing the 1B expansion starting tomorrow for some of those people due to some of those concerns about supply. I mean, how do we get there? How do you get Peoria County there?
Well, let's start with the reason that we're opening to 1B plus, and that is that these are the most vulnerable people really with comorbidities. They're the most vulnerable populations, the populations of color, communities that otherwise are suffering the most from cases and hospitalizations and deaths. And so we want to make sure to cover those communities as quickly as we possibly can. We're all struggling all across the country with the supply that comes into our states. And unfortunately, no one's getting enough supply for anything that we all want to do. Indeed, I think we'd all like to make sure we could vaccinate everybody today or this week. If we had enough supply, we actually probably could do that. But right now, what we're doing is making sure that the most vulnerable people in those communities have access to the vaccine anywhere and everywhere we can. We're working with our local public health departments to help them get to the phase 1B as quickly as possible. Most of our local public health departments are moving into that phase.
And if the J&J vaccine comes online and it's approved by the FDA, is there any word on how much Illinois is getting? Will that be a game changer for our rate of vaccination?
So it's said that by the end of March, we will have a 20% increase overall in the amount of vaccine that our state will be getting, and all the states will be getting if J&J is approved later this week. I'm really looking forward to that. But even without that, we are going to have by mid-March, by all of the projections given to us by the White House and by the vaccine manufacturers, 100,000 doses per day for Illinoisans. Think about that. We're now able to vaccinate an average of about 60,000 people per day. That's going to go to 100,000 in just 2 weeks.
So will that like a jump up, or will that be a steady increase to that figure?
It'll be a steady increase to that figure, but we're already seeing. I mean, we're getting calls. I am from the White House about what the next steps are. What the incremental moves are. I want to credit the White House with doing one really important thing: communicating. The prior White House, the prior administration, the communication was very incomplete, infrequent. We weren't getting the information that we needed. We're getting projections that we can rely upon from this White House, and that's very good for people who want to get vaccinated soon.
Based off that current increase that you mentioned from the White House, when do you think phase 1C could have happened for Illinois?
I don't want to speculate. It's very hard to say exactly because I don't have a projection out far enough to really know. But I'm anxious, I think like we all are, to get to phase 1C and beyond. We want to get everybody vaccinated as soon as possible, but we're trying to get to all of the most vulnerable populations first.
Governor, some of our small and independent pharmacies say they are ready and willing to step in and administer vaccine, but they haven't received any yet. Is there any plans to get vaccines to some of those pharmacies?
We absolutely want to, and again, this is a supply issue. Remember that the larger pharmacies, the prior administration actually signed agreements with the very large national pharmacies to distribute to them. So they are under a contract that's pre-existing. They are getting vaccine directly. As vaccine doses increase to the states and is more available to the federal government too, either these smaller pharmacies will be able to get their doses directly from the federal government, or our counties and our state will be able to allocate to those pharmacies. But again, it's a supply issue at this point.
With now 3 vaccines on the horizon,
Yeah.
numbers going down, what do you need to see for us to go to tier 5?
Wow. Phase 5, yeah, of our Reopen and Restore Illinois plan. I've said from early on that what we need is an effective vaccine that we can widely distribute and a very effective treatment that we could widely distribute, and we're getting there. I mean, like I told you, we're about 1 in 7 Illinoisans already has their first dose in their arms. We need to get closer to herd immunity for everybody to feel, that we're beyond phase 4, and for us to actually be able to reopen everything entirely. As for now, as you know, we've not had a stay-at-home order since back in April and May. And we have, in fact, restaurants are open, bars are open all across the state of Illinois, gyms are open, we have sports running in our schools and so on. Not to the large extent that we'd all like. We'd all like to, I think, rip off the masks that we're all wearing every day. And, we'll get there, but it's going to be, we have to get vaccines into people's arms.
Question for Monica. I have a question for Monica.
Sure, yeah.
Monica, with this Johnson & Johnson vaccine, the efficacy is lower than what we see in Moderna and Pfizer. What would you tell folks that if they become eligible for the vaccine, Johnson & Johnson's available, they're worried that it won't be as good as the other two options?
So the question regarding the efficacy differences between Johnson & Johnson, a single dose versus the current vaccine, I think it's key to understand from the research that all 3 vaccines in terms of mortality, so death, as well as severe illness, are actually 100% effective. So really, you're looking at a distinction that from a clinical standpoint or from an epidemiological standpoint is very minor compared to what we really are hoping for, which is decreases in death and decreases in severe illness, where they all match up between the 3 vaccines. The most important thing, though, is that when these vaccines come on the market, if you have an option to any of these 3, get one of them. And that's the key message that we want to make sure people get. And also, likewise, if you kind of do a comparison for influenza vaccines, which we do annually, influenza's efficacy can range anywhere from 40% to 60%, and that's a good year. So again, something this high, public health was, we were hoping for something above 40%. To get to 95%, even 65%, that's a home run.
Monica, I just want to confirm that from last week, basically, still, we are not expanding the 1B population route. You're still here to Tri-County focused on that 65 and older, those frontline non-health care.
As of right now, the Tri-County is not going to be moving into the 1B+. I think really it's going to be that moving target, and as the governor mentioned, this week a lot of us got that second doses. So a lot of our systems are using that this time to really play catch up and get second doses in arms. So again, with the expansion of the vaccine, moving past the second doses, we're hoping to reassess, and we reassess each week based on those projections that come. When we do make that decision, we'll make sure that we advertise that and communicate that with the general public as soon as possible.
Thank you, everyone.